So, Kit, thanks again for joining us. In terms of how bad is the situation, because if I was going to put my big, notorious Tory stooge devil's advocate hat on, I'd say, come on, very successful vaccination program. Yes, the deaths that we're seeing are terrible, but they are significantly lower than the two peaks that we had in spring of 2020 and obviously the horrible winter at the beginning of the year. And it's manageable. So given the trade-offs, is this really as bad as people say it is?
Well, I think, we heard Sajid Javid suggest that deaths are mercifully low at the moment. I don't think that's the case. We're averaging about 136, 137 deaths a day, which translates to about 50,000 deaths a year. Yes, vaccines have made a huge difference, and that's been incredibly important. And yes, deaths are low in comparison to January and to the spring peak. But those are two incredibly low bars to judge our current response against, given that we now have vaccines. All the COVID indicators in the UK are going in the wrong direction at the moment, and they have been for a while. Cases are surging upwards. Hospitals are already feeling pressure. We're only in autumn. We're not in the middle of winter. And daily death tolls are high and rising. And at the same time, we're seeing a slowdown of vaccination delivery. And so things in the UK are not looking pretty, especially when compared to our comparative European neighbours.
In terms of how bad things could get, what for you, I guess, is the best scenario based on the data we have now, and what is, I guess, the realistic and the worst case scenarios of where we're currently heading?
I mean, it's really difficult to say because so many unknowns. I think if we speed up the booster jab program, if we speed up vaccinating 12 to 15-year-olds, and if we can provide more mitigations in schools, because we know it's largely school children who are driving the epidemic at the moment, although cases are spilling over into their parents' age group and their grandparents' age group. That's the sort of real worry. Then it's possible that we can bring this under control. I think it's sensible to think about talking about other mitigations like mask wearing in public spaces as well, improving ventilation, potentially vaccine passports, things like that, which we know have had a big impact in our European neighbours. Unfortunately, if we don't do anything now, then cases look set to continue to rise and hospitalisations and deaths will follow. And that puts further pressure on the NHS. And it means that we're also not clearing the backlog of operations and treatments that haven't been given by the NHS over the last 18 months. So really taking sensible light touch measures now, this is one lesson we should have learned from all the mistakes we've made so far, taking early measures now is much better than taking more stringent, harder measures later on.
Compared to our European neighbours, why are we doing so badly? Because, of course, for a long time, the government tried to, I suppose, scrub away the sin of the terrible handling of the pandemic, which led to one of the worst death tolls in Europe, by trumpeting, of course, the vaccination program, which was a huge, huge success, delivered by the National Health Service. But it was a huge, huge success. So why all of a sudden, compared to many major European nations, we're doing so bad in terms of case numbers, which are just way higher, hospital admissions, deaths, serious illness, every statistic. Why has that happened, and what could have been done to allow us to be in the same situation they're now currently in?
Yeah, so just for context, Germany is seeing case rates about a quarter of what we're seeing in terms of per head of population. France is seeing roughly a 10th and Spain maybe a 20th. And with deaths, Germany is seeing about a half of what we're seeing in France, and Spain seeing about a third. Ironically, part of the reason is due to the fact that we did roll out a very successful fast vaccination program. We've now learned that immunity wanes to some degree. So we're suffering to some extent the fact that we gave our jabs longer ago and now we need boosters. Of course, that is going to be hopefully rectified by the booster program, but that isn't keeping pace with the rapid pace at which we gave our first and second doses. Also, we were using AstraZeneca, which we know isn't as effective protecting against severe disease and reducing transmission as the mRNA vaccines that the rest of Europe were using. But probably the main factor is the fact that most of the rest of Europe realised this wasn't over and have maintained some restrictions, including masks in public spaces, some countries not allowing huge gatherings, COVID passports in some countries, and they've managed to keep on top of their case rates and their death, and they're keeping them low as they head into winter, so that even if things do start to rise, they'll at least be starting from a low base, whereas we in the UK are already starting from a relatively high level, and of course that's a concern.
In terms of how other respiratory infections could interact with this, because again, I speak, as people probably know, as not someone who has a specialism in this area, but community immunity has fallen, hasn't it, when it comes to flu, because the measures taken to suppress COVID, which is a far more infectious illness than flu, means that flu was essentially just completely obliterated in this country for such a long period of time, as well as other respiratory illnesses. Lots of people watching or listening will have or currently have a terrible cold, which is going round. Lots of people I know have been stricken with that. They all got their COVID test. It's not COVID. So what's the danger in terms of how all that interacts? Because I read, for example, that if you have flu and COVID together, then the death rate is twice as high. So what do you think that can mean in terms of how that affects the National Health Service and how this pans out in the winter, basically?
I think it is a concern. I'm not an expert on flu either, so I won't go too far into that. But of course, if we have a concurrent epidemic of flu running at the same time as COVID, then that's going to put more pressure on the NHS. In terms of the bad cold, I think that's true. There's lots of that going around, but also we mustn't forget that in the Southwest, a lot of the stories of the bad cold were coming from the Southwest, where people were testing PCR negative. And in fact, they were being given false negative results by the Immensa Lab in Wolverhampton. And in fact, they did have COVID. And actually, that's contributing to some of the high case rates we're seeing. The Southwest is currently a sort of epicenter of the epidemic in the UK, because people were told that they were not infected with COVID. They went to work, they went to school, and they infected their colleagues and their classmates. Maybe carers even went into care homes. And so they're seeing a particularly bad or particularly high rates of COVID at the moment. But overall, yeah, it's important for people to go and get their flu jabs, but also for us to try and keep on top of COVID if we want to reduce pressure on the NHS.
So as we know, the vaccination program was a tremendous success. So a lot of people are a bit confused about why the booster jab and program plus the vaccination program for younger people, why is it being so slow? Because clearly, if that was sped up, then we'd be in a much stronger position going into the winter.
Yeah, absolutely. We did do an incredibly fast and good job of rolling out the first and second doses. The booster program is not currently able to keep pace with that. We're seeing an increasing proportion of people falling beyond this 6-month period after which we want them to get booster jabs, because we just can't keep pace. Part of that is due to confusion. We're hearing mixed messages about whether you should be actively booking your jab or whether you need to wait to be invited. In terms of childhood vaccination, so vaccinations for 12 to 15-year-olds, who are the people who are most impacted by COVID at the moment, they've got the highest rates of COVID. We've tried to do this in a really different way to the way we did with adult vaccination. We are trying to do it in schools, often through private healthcare companies, and we're hearing lots of examples of that being cancelled in schools when people have got COVID, which is extremely high in that age group. They're not allowed to have their vaccine. And actually, it would be much better, and something which is about to be rolled out over half term, is if we could just do exactly the same thing we did with adults and just book into a vaccination centre, a walk-in centre, and get your jab done. But at the moment in England, we're seeing only 17% of 12 to 15s having been vaccinated through this in-school programme, whereas in Scotland, where they've been using walk-in centres from the start, they've jabbed over 50% of that age cohort. So it's organisational issues. It's nothing about the willingness of people to come forward and get vaccinated, but those two things would make a really big difference to COVID levels, as well as doing things in schools like just basic mitigations like mask wearing, encouraging ventilation, maybe getting those CO2 monitors that were promised in the summer actually into schools. Apparently only 2% of them are in schools at the moment. So doing all those sorts of things would really help.
Now, we've seen a few hashtags trending, no more lockdown, and there's a lot of talk about lockdown, the spectre of lockdown once again. And I suppose having gone through this now for a year and a half and having had a mass vaccination program, even lots of people who are very supportive of lockdown measures hear just that term and go, we don't have the emotional space to go through that again. So what is the prospect of another lockdown, and what in practice are the sorts of measures that can be actually taken to avoid a later, far worse, situation than we're currently in?
So absolutely, let me be completely clear to start with, though. Lockdowns are not something that anybody wants. Nobody wants lockdowns. Lockdowns are what happens when you fail to control COVID through other measures. In fact, the people that are ironically advocating for lockdowns are the people who are suggesting we have no restrictions at all now and just let things take their natural course. We can do some relatively simple things because we've vaccinated large numbers of people, which will allow us to control COVID measures. Things like reintroducing masks in public spaces. Instead of shifting the blame onto the public for not wearing masks, simply say, if you're on public transport, if you're in a large gathering, then you need to be wearing a mask. It reduces transmission. Things like improving ventilation in schools and workplaces, making contact tracing work better. So, for example, in schools, contact tracing has been devolved back to test and trace, who have absolutely no idea about how to find the contacts of people who are in schools, whereas schools themselves actually have all those contact details available. So there are a number of things that we could be doing to make things better. Improving vaccine rollout is one of those things as well. And the point is that we should be acting now in order to try to make sure that we can bring cases down, to slow the spread, so that we're in a better position as we head into winter, rather than just laissez-faire, letting things happen. It's time to activate the government's plan B, because if we don't do that now, then we're going to end up having to activate plan C. And as far as I know, there is no plan C. And if they do come up with one, it's bound to be worse than the measures they're suggesting in plan B. So act early. That's the message that we should have learned throughout the pandemic.
Kit, real pleasure. Thanks so much for setting out in very clear detail the situation we're in, how we got there, and what we do to escape an even bigger disaster.
Absolutely. Cheers, Owen.